Hi there, my name is Viva. I'm an ENT Consultant surgeon that works for the National Health Service in England. And today what I want to do is tell you about how to pass viva examinations. Viva examinations are when one senior doctor interviews another junior doctor, fires questions at him left and right, just to see if he knows enough to pass the exam. So what I want to do in this video is to give you some tips and advice about how to succeed in these types of examinations so you can get the best results and best marks. So generally in these viva examinations like the MRCS, FRCS, you'll have 2 or 3 examiners sitting in front of you and they'll take it in turns to fire questions at you. Sometimes there's a silent examiner who sits there making notes and makes sure that everything's going according to plan. They typically try and get through at least 3 scenarios with you. Each scenario they have about 5 questions each. The first 1 or 2 questions are about warming you up, easing you into the questions so you don't feel so nervous. The middle questions are the ones that help you pass or fail an examination, and the last few questions are given to exceptional students, and they're the ones gunning for a prize or something like that. So what I'm going to do is talk to you about how to answer the first questions, the middle more juicy questions where you get most of your marks, and those final 2 questions at the end which will help you get top marks. So as I said before, the first few questions are rather easy and they're meant to ease you into the scenario so you don't feel lost or anxious about it. The problem is that when most people try and answer these first few questions, they do rather badly and then waste all their time. It's important to remember there's only 1 or 2 marks at the start for this first question, so try not to waste all your time on it. Let me give you an example. The examiner asks you, you're sitting in clinic and a 48-year-old woman sits down in front of you and it's clear that she has a 5 centimetre mass in the thyroid area. How are you going to approach this case? Now this is an incredibly easy question because all of us have pretty much sat in front of a patient such as this. We all know how to deal with thyroid problems. But it's surprising how many people get this question so badly wrong in the exam. So what I'm going to do is start off with a bad example of how to answer this question. And hopefully you'll see why in a minute. So the first thing I'll do in my normal clinical practice is introduce myself and ask for consent to take a history and examination and explain that I want to talk to them about this mass in the front of their neck. I'd specifically talk about when they noticed this lump, how long it's been there for, how quickly it has grown in size, and if they've ever had anything like it in the past. I'd ask about the overlying skin, particularly if it's tethered, and if they can move the skin above it. Has there been any skin changes, any rashes, and are they able to move the lump at all in their neck? Does the mass move when swallowing or sticking out your tongue? And if I believe this to be a thyroid problem, I'd ask them about thyroid questions such as do they feel. So you can see I'm spending an inordinate amount of time on this question, which is probably only worth 1 mark. You have to remember that examiners are sitting there with a clipboard and a piece of paper, and they're waiting for you to say a certain collection of words to give you that mark. You're unlikely to get lots of points for taking a history. Taking a history is a medical student thing. If you're looking to become a surgeon, they expect you to be able to take a history because that's what you learnt at medical school. So there'll be very few marks for showing how you can take a full history, when really you want to get onto the juicy middle questions where most of the marks are. What I was doing in that answer was giving a scattergun approach and hoping that I'd collect marks in it. And I'm afraid that's not going to work very well because you'll just waste time trying to guess what they're looking for. And the other problem about giving such a long answer is that the occasional pedantic examiner will turn around to you and say, isn't employment history important in this situation? And of course it is, but in your anxiety of saying all the things that you can possibly think of, you may forget 1 or 2 things. And then that puts you on the back foot and makes you look silly. And really what you want to do is try and give an answer that will cover all of these areas. So my advice would always be, if you're given a vague question, you should answer with a vague answer. Let me give you an example of a very safe but not particularly good answer for this question. What I would do in this situation is take a full ENT and thyroid history and examination and start with some preliminary investigations. So as you can see, I've given a very vague answer to this vague question. I've covered myself, so if anyone comes back to me and says, oh, what about employment history? You say, well, of course, that's a part of my full ENT and thyroid examination history. The only problem with that answer I've just given is it doesn't display any higher order thinking, and that's what they're really looking for at this level. If you're hoping to become a surgeon, you need to display higher order thinking and show that you can think a few steps ahead. A better example would be to say, in my normal clinical practice, I'll take a full ENT history and examination, but because I'm concerned about a thyroid problem here, I'd specifically ask about thyroid symptoms, hoarseness, aspiration, a past medical history of thyroid disorders, and exposure to radiation. As you can see, this answer is a little bit better because you've given that vague answer to a vague question and you've covered yourself, but you've also tried to display some higher order thinking. I think it's important to show some higher order thinking because you don't want to come across as like a politician trying to dodge every question. A lot of people worry, oh, if I haven't mentioned something, I may not get that mark. Don't worry, examiners are trained to bring you back if they need to. So for example, in that situation, the examiner might say to you, do you think where they were born or where they grew up is important? Then you can launch into your information about if they were born within 300-mile radius of the Chernobyl disaster in April 1986, therefore there's a higher rate of them having thyroid cancer or other problems. Then at least you're getting that mark rather quickly and succinctly, and you can move on to those middle questions where most of the marks are. Sometimes in these initial questions, you can go into autopilot. And what I mean by that is there are questions which you can give a padded phrase or a whole paragraph of words without you even needing to think about it. So, for example, if someone asks you a question about a severe bleeding event, you can launch into your resus diatribe where you say, I'd immediately attend the patient because it's a medical emergency. I'd make sure that I'd assess the need for immediate resuscitation, checking airway, breathing, and circulation. I'd start by giving 100% oxygen with a rebreathe bag and ensure that I've established 2 wide-bore cannula in both antecubital fossa and set up some IV fluids. I'd also start monitoring with a blood pressure cuff, pulse oximetry, and a full 12-lead ECG. And so all you need to do is memorize that or something similar to that so that you can say it without even thinking about it. So while you're saying all this stuff, it's coming out autopilot out of your mouth without you even thinking about it. You can think to yourself, what's this guy actually asking me for? How can I answer this question better? How do I not look stupid in this situation? So by the time you get to the end of that rehearsed bit, you can come out with a proper formulated answer. The same thing can occur if someone gives you a CT scan or a chest x-ray, something like that. You can start off by talking about the position, the penetration, things like that. This is an axial CT, contrast enhanced CT scan, for example. You keep talking like that for a little bit, giving yourself enough time to think about what your answer is going to be. This really helps because it avoids those awkward silences where you're staring into space trying to think of an answer. Because in those situations, it just looks like you don't know what you're talking about or you're completely lost when you shouldn't really be. It allows you to say something and get on with the examination, hopefully racking up 1 or 2 points while you're coming up with an answer to the question they actually asked you. Coming out with something immediately really instills confidence in the examiner and gives you a few extra style points and gives them confidence that you'll be able to pass this exam. So once you've answered that initial question, it's time to get onto those middle questions, and most of the marks are in this area, so this is where you pass or fail your viva. It is really important that you don't dig yourself into holes when it comes to these questions. If you find yourself going down into a scenario where you really wouldn't do this in real life, just stop, throw up your hands and confess and say, sorry, look, this is never going to happen. I'm really sorry. Can we start again and start afresh in this situation? The point is that you're trying to avoid being led down a mad series of events that you'd never do in real life. Take, for example, the case of a 5-year-old boy with a bleeding nose. I appreciate that the ladder of care is that eventually you end up with an external carotid ligation. But think to yourself, you'd never take a 5-year-old child and tie off the external carotid. It just wouldn't happen in real life. It's probably better just to pack the nose as well as you can and then go and ask for help. Remember, most of the time the examiner's not trying to make sure that you know every little detail in the book. They mostly want to make sure that you're a safe practitioner. You're not going to go rogue and do strange things in the middle of the night. So my advice is that if you come across a scenario where you've not been in this situation before or it seems particularly strange, I'd just say, look, this is not a scenario I've been in before, and I'd enlist the help of some senior colleagues to try and help me through. Try and avoid ever being pushed into a situation where you're doing an operation which you really wouldn't do in real life. And if they are pushing you down that route, just say, in real life I wouldn't do this, but I'm aware that. Then you can go on and tell them about the ladder of care that you've read in the books. You will be faced with a few questions where there's a variety of different treatment options. And what I would say in this situation is reply like this. In our department, in this particular case, I suspect we would do chemoradiotherapy, but I am aware that in other departments, robotic surgery with radiotherapy post-operatively is the standard of care. It shows that you know the breadth of different treatment options out there, and it also shows the examiner that you've been in this situation before and you know how to deal with it. It also shows that you're safe. You're not making any unilateral decisions by yourself. You're always asking for an MDT or you're asking for colleagues to help you. You have to remember that consultants normally get sued in the first 5 years of their consultant life, mainly because they don't ask for help. So if you're unsure in the exam, just say, look, I'd ask for help in this situation. It's not a situation I'm often in. The other bit of advice I'd give you is to always practice staring straight at the examiner and looking for those non-verbal cues. Remember, we're all doctors. We're not trained to be examiners or interviewers, so we're not very good at it. So although the examiners have been told you mustn't give any non-verbal or verbal cues that they're doing well or doing badly, we can't help it. We've sat in front of patients all our lives and we've been giving them non-verbal cues to allow them to keep talking, allow them to encourage them to give you more information. To suddenly turn that off in examination in front of a person that you probably already know and you've already trained before, it's going to be quite difficult. So stare at your examiner straight in the eye and try and work out if you're doing badly or if you're doing well. If you're doing well, carry on the direction that you're going. If you're doing badly, try and stop the answer that you're giving and allow them to redirect you back again. And the other benefit of this is that you're giving eye-to-eye contact, and that helps build rapport, and that allows your exam to give you more marks. Because you look confident, you look like you know what you're talking about, and they're more likely to think, yes, he knows what he's talking about, and giving you that mark. It's often quite hard stopping an answer because a lot of people get carried away and start talking about nothing, mainly because they're nervous and they don't really know how to stop an answer. Learn just to stop. Even if it looks awkward, just stop, because you talking is just wasting time and wasting your marks. A good examiner will pull you back and say, this is what I really want to talk about, and then you can answer that question and get those marks. If you truly don't know something, say so and ask them to move on if possible. Instead of you staring blankly into space and not knowing what to say and looking very awkward and feeling red in the face and getting more and more anxious, just say, look, I'm sorry, I don't think I understand what you're saying. Is there any way you can rephrase that? If you still don't understand, see if you can move on as quickly as possible. It's better to get on to the next question and redeem yourself with those next answers. Try and answer as swiftly and as concisely as possible because it really helps you move on to those other questions where you can get more marks. Try not to waffle. Try not to go on one point. Even if you've done a PhD in something and you want to really display your knowledge, you're only going to get that 1 mark. There are no extra marks for doing one question really well. You're only going to get 1 mark. Everyone says that this is meant to be like a chat in the corridor with one of your colleagues, and although they say that, it feels nothing like this. But try and pretend it is. Practice looking calm and relaxed and confident, and only giving the important details on what you're trying to say. Looking very tense and stressed out is not really what they want to see. There will be 1 or 2 questions at the end which will be very difficult, and they're mainly based on those people who are going for the prize or the gold medal or whatever you want to talk about. So don't worry if you get to that point where they ask you a strange, really difficult question and you don't know the answer to it. Just think to yourself, oh wow, they've asked me this question, I must have passed now. And if you really don't know it, don't waste any time on it. It's only 1 or 2 marks. Move on to the next question. It's really important to get all the marks you can in the examination. Obviously, if you know the answer, just tell them as quickly as possible and then move on to the next question. Typically, to get top marks, you need to start quoting or referencing papers that are in the medical literature. You have to be extremely careful with this and only pick out things which are irrefutable and are really useful in that particular question. And equally, don't go over the top just to try and get those top marks. For example, saying, oh, the paper that I use for nasal packing in the epistaxis, it's almost meaningless. No one wants to know about that. You're not going to get top marks for quoting that bit of evidence. If, however, they gave you a very specific question about, for example, would you give radiotherapy in this situation, then you can reference a paper if necessary to try and get those top 1 or 2 marks. But again, just don't overdo it. I think it's worth mentioning that how you present yourself in the exam is really important. A lot of this exam is about style over content and delivery of that content. It's not exactly acting, but it's coming across like a consultant. And you have to remember that the people examining you will be in their sort of late 50s, 60s. These are the sorts of people that start examining. So try and get as much practice with those sorts of people as much as possible before the exam. You need to learn how to talk like them, act like them, answer questions like them. Because if you're answering questions like they want to hear, they'll think you know what you're talking about and they're more likely to give you marks. They're more readily able to give you marks because in their mind you're doing very well because they're thinking like they are. It's a silly psychological thing, but it's worth saying it. When you turn up to an interview, don't dress like I am right now. I dress up formally and professionally and always think to yourself, would my dad or would my mum think that I'm well dressed for an exam? Don't think what you would think is best for the exam, because remember you're talking about examiners who are in their 50s and 60s and you need to meet their expectations, not what you think is cool and what you think is good looking. Try and look as professional as possible and don't draw attention to yourself with bright colours at all. Just stick to blacks and greys if you can. You're not trying to show your personality in these exams, you're just trying to pass the exam, get through it and go on to the next stage in your career. There's an awful lot of anxiety when it comes to these exams. Remember, these examiners are not trying to catch you out. Most of them are trying to help you through the exam because they want you to pass. And typically they're all rather bored because they've heard the same answers to the same questions all day. Try and be entertaining if you can. Try and throw in a bit of humour if you can, just to make their lives a little bit easier. Probably best to only do that on those questions which you know you can answer, you know you're doing very well in. When you start getting good at giving viva answers, you'll notice that the examiner normally sits back after the first minute or so because they're just, oh, this person knows what they're talking about, I can just pass them, I don't have to drag answers out of them. When you get to that point, you know you're relatively safe. You just need to not make any silly mistakes and just get through the exam. And remember, there's a normal distribution curve with all examiners, all people, all doctors. There are some examiners which won't be very good. And it's worth practicing with people who are known to be not very good examiners because it helps you get around certain questions and they may phrase things differently. Learning how people phrase things is important, not only for the exam, but also with your patients. Trying to ask politely what people are saying, what people are asking does help get you out of sticky situations and therefore you can get on and get more marks. No matter what the situation, always look calm and relaxed, always smile back at the examiner, always look like you're in control. Being scared and anxious is inevitable and they all know that, but it's worth recording yourself like I'm doing now on this video and playing back how you answer questions, because it shows you little mannerisms which you think, oh, I shouldn't have done that, I look a bit crazy there, or I look really nervous, I really got to calm that down a bit. When you're revising for a viva, do remember that most of the questions are going to be about treatment. Almost all these questions are set by surgeons, and once you've been a consultant for a few years, all you ever think about is treatment, and you forget what bug causes this and what the biochemistry of this condition is. And so the real marks are in the treatment of every condition, and that's what they're going to be looking at. Even if you think, or even if you know you're correct in an exam, don't ever argue with an examiner. It doesn't matter. It's not worth losing an exam over a particular point. And it can be subtle things as well. Don't ever say, people don't do this operation anymore because it's very archaic or something medieval. So never say that one operation is bad, because there are some people out there that will still do that operation. And you may be sat across from someone who does that operation. Never belittle anyone, never argue. Preparing for a viva examination is more about practicing this interaction, practicing with friends, trying out different techniques of how to answer things. When you're practicing with a friend, try and get them to pick holes in your arguments, pick holes in what you say, and slowly you'll pick up techniques about saying things or avoiding to say things that cause you to dig yourself into holes and things like that. It allows you to come across much more polished and avoids you getting into situations where, you're trying to backstep and get out of a situation. And in an exam, it's quite difficult not to say the wrong thing. But if you're practiced at it, you practice not saying silly things, then you'll do rather well in this exam. So thank you very much for watching this video. If you've got an exam coming up, good luck. I'm sure you'll do very well. And of course, if you need some help with Zoom these days, I'll try and help you as best I can.